procedure that we do that serves to replace the broken down enamel on the tooth. A tooth can need a crown for several reasons. One, if a tooth fractures, or if the tooth becomes so sensitive for whatever reason, the filling was, the decay got too deep that the tooth, got involved, and maybe it needs to have a root canal. So it needs to have something strong to basically replace that tooth. Think of it this way: you're replacing the siding, the wood on the house. It's broken down enough that finally you decide, I'm going to get siding on the house. You don't throw the house out. You just replace the siding on it, and that gives it back the support it needs and brings it back into the proper form and function of the tooth. When a patient has a tooth that's broken down enough that it needs to have a crown, sometimes it can be because it just, had a deep, cavity or a fracture because you bit into something wrong. A lot of need for crowns I see with patients is because the tooth slowly and methodically is broken down over time because the function is not right on that tooth. And so if we just go and replace the tooth, put a crown on that tooth, and in the same position that that tooth was in before, not looking at why did that tooth break down in the first place, then we're just putting a bandage in there, but we're really not going back and treating it at the source of why that tooth broke down. And often, those are the crowns that the patient will come back, if you're not looking at the function, that tooth hurts when I bite on it. It's still really cold sensitive, and it's, I bite, just right on anything and that tooth hurts. Why does my tooth hurt after it's had a crown? And a lot of times we can prevent some of those complications, not all of them, but some of those complications can be prevented just by making sure that we look at what the reason why that tooth broke down and not recreate that same problem. So the crown that is restored, or the tooth that's restored in my office, is going to have not only a crown that looks good, but it's going to feel good, and it's going to last a lot longer because we've corrected all the reasons why that tooth broke down in the first place. Most people don't want to have a crown in the first place, but what they do appreciate about us is that we're very thorough, and we make sure that we follow up with our patients, and are things going okay for them. Because there can be some complications. I tell my patients all the time that a crown is kind of like putting a knee brace on a bad knee, and sometimes that's all it'll need, and that'll be fine. But other times we'll find that the knee is so bad that sometimes other treatment needs to be done. So we follow up and make sure that everything is feeling okay for them. But I would say it's very few times that we have patients that come back and they're having issues that cannot be resolved very easily. It really is only 6 to 10% of teeth that have, in across the board of all crowns, that teeth need to have further treatment. I think the things that my patients appreciate is that I do spend the time listening to them and making sure that everything in the whole process goes well, and really preparing them for what to expect after the procedure. We have some equipment, special digital equipment, that allows us to fabricate crowns right here in our office. With the right tooth, which the majority of them are, we can create the crown using a computer assisted design, and then I will take an optical impression of the tooth instead of the goop that goes in the mouth when you make a crown. We can actually make an optical impression. What that does is allows me to design the crown on a computer and send it to my lab here, which actually we can then create the crown, where we can fit it, and actually the patient can go home with a great looking, great fitting, strong crown the same day. They don't have to deal with missing work twice, they don't have to worry about being numb twice, which is a great benefit. And say they're on vacation and they have a temporary crown, they're not worried about whether they're going to lose that temporary crown while they're on vacation. So it's a really great thing for our patients, and they just love it.